Welcome to Stethoscopes and Student Standpoints, the official podcast of the Alberta Medical Association, AMA, Medical Students Advocacy Committee, and the first ever inter-school podcast led by medical students in Alberta. My name is Sana.
And I'm Abdullahi.
I'm really excited for this episode. So we're definitely going to talk about AI in medical research and how AI can be used in actual clinics and in hospitals, what's been done so far across the world. But I kind of wanted to start off talking about at the medical student level, the U of A and the U of C, we're really seeing interest in AI grow because in the next couple years, it's probably slowly going to try to get more incorporated, not only in the medical education level and for teaching medicine, but actual practice of medicine. So there's a lot of student-led AI and interest groups that are focused on this digital health, but there's still a gap. The curriculum, of course, can't fully catch up because it's so new. And it's because if we don't understand how these tools work, we can't advocate for their responsible use.
Yeah, and as medical students, we're being trained in systems that may look totally different in a few years with the implementation of AI. And the biggest question to ask is, are we getting this exposure to be able to critically appraise algorithms the same way we critically appraise research and studies? And are we learning how to work with AI instead of fearing it? And so this is the kind of work that these student-led AI interest groups and initiatives are helping us as students bridge that gap with. Recently, I did an online course on AI and research, and I thought it was very insightful in helping us as students, learn how to appraise AI in a clinical research setting.
Yeah, and even looking at how it's currently being used at our exposure at a student level, I know that we have some clinical placements in our first 2 years of medical school at the University of Alberta. And I know a lot of students and friends I've been talking to have told me that their preceptors in these family medicine offices help use AI to write their notes while the patient is speaking. And that makes the experience so much better. I can see why just being a patient and just a person, having a doctor in front of you typing the entire time can be less impersonal. So having that AI writing the notes and taking that administrative load off is really helpful, especially for family medicine, which has quite a high administrative burden that physicians struggle with. So that's been a great application of it.
I know we've talked about some of the positives of AI and the value that it brings to the healthcare system, but another important discussion we have to have is, how does AI fare in terms of ensuring that it's equitable and accessible to everyone in the healthcare system, and that it can help us meet the unique challenges facing Alberta?
Yeah, and like we know, Alberta has a pretty large rural population, and some of the gaps of rural healthcare have already been highlighted in previous episodes. So that's one area where AI has the potential to help, like remote monitoring or connecting people in rural care with specialists that they don't have access to. But it's really important that these communities have the infrastructure and the broadband to support it.
Exactly. And let's be real, tech solutions can't replace the physician shortage. They can support physicians, but they can't substitute the human aspect of medicine. So we also need to invest in training and oversight to ensure equitable implementation and access. As you mentioned before, some of the critical infrastructure like broadband or even access to the technology might not be in place. It won't be able to support or fill the gaps that we're betting on it to support, right?
Yeah, and as the next generation of physicians, we have a pretty important role to play, not in just using AI, but in shaping on how it's used. And that means really asking tough questions in class, pushing for curriculum reform, and speaking up when tech is being implemented without proper clinical validation. But I think already the system is so cautious about using AI, and it is being very, very slowly introduced, which can be beneficial as well.
Yeah. and even beyond the classroom, can write, publish, and join advisory committees and advocate for policies that make tech equitable and ethical. This is especially important in Alberta, where healthcare reform is a live conversation and new tech is being rolled out fast. This isn't about being anti or pro AI, it's about being thoughtful. We need to make sure that as we move into the future, tech enhances patient care without replacing empathy, cultural humility, clinical judgment, and most importantly, without leaving anyone else behind.
Yeah, and I know that's kind of wrapping up the discussion about AI in clinical care, but I think something that's also important to talk about is using AI in medical research. Abdullahi, why don't you start the conversation on that?
Yeah, I think one really big thing I learned this year is how valuable AI can be, especially in quality improvement research. And so there's a lot of research going on now, or new research. Physicians are actually doing quality improvement studies. So there's always the retrospective arm of the study where they look at some sort of issue within their clinical practice or their surgical practice, and they kind of figure out what are the needs, right? Or what things require quality improvement. And once those are identified, AI can actually be used to implement that quality improvement. And I see this as a novelty in medicine that'll really change the way care is provided and the quality of that care. And I think this type of research it really highlights that implementation we've been talking about of AI, using it in a smart and sensible way, right? Ensuring that it's improving the quality of care, it's not leaving anyone else behind, and it's not also taking away the human parts of medicine, right? If anything, it's adding to it and making sure the patients walk out with a great experience and improving the quality of care. And so this, I think, is like a gold standard, 10 out of 10 of implementing AI into our healthcare system.
Exactly. So in this episode, we've talked about applications in medical education, in actual clinics, and also now here in research. So AI has been useful to the various areas of medicine and has various different applications. So almost joining forces with AI and like Abdullahi said, not being either anti-AI or pro-AI, rather critically thinking about its applications are especially important at the student level.
Yeah, and so that concludes today's episode of Stethoscopes and Student Stats Points, the official podcast of the AMA Medical Student Advocacy Committee. If you found this discussion insightful, make sure to subscribe and follow us for more conversations on medical education, advocacy, and healthcare reform.
Be sure to check us out at amamedicalstudents.com and see you next episode. Bye.